Operations Center. As we are all aware that the country is dealing with a crisis, which is the COVID-19 outbreak. This center is the place coordinating all response in the country. We have a committee that is running the affairs of this center, and I will give them chance to dwell much into this committee. Who are they? What are they doing as far as this COVID-19 response is concerned? And the chair of this committee is here. That is Mr. Siring Moduju from National Disaster Management Agency. This shows you that the crisis at hand is not Minister of Health show only. It's a national issue, and there are times when such kind of outbreaks happen. The leadership of response has to be given to people that are being designated to run those affairs legally. And we all know National Disaster Management Agency is responsible for coordinating all kinds of disasters in the country. So being as such, Mr. Sirim Mod is the chair of this committee, and he will give us more details about this committee and how the operation is going on right now as we are speaking. Then we are not going to take much of your time. This is an update. This is going to be on daily basis except Sunday. So from Monday to Saturday, we will give you an update of the situation we are dealing with right now, which is COVID-19 outbreak. And I guess you are all aware that Gambia have registered a case. So with that, we need to update you frequently because our team are out there in the field. They are doing contact tracing. They are sending people for testing. So the lab results we are getting as well. So the country needs to be aware. They need to know what is going on. How far are we? How many cases have been tested? How many turned out to be positive? How many turned out to be negative? The country needs to be updated regularly. So we have put up this system to have this close collaboration with the media personnel, because you guys are the mouthpiece of the country. So whatever we give you, we believe the whole country will know about it. So we will give you an update. Monjai will read the update quickly, where we are right now. Monjai will give you those updates, and he will quickly read the update, and then we will have time for question and answer. So we don't expect much speech. It's just opening, and then Sharing Mode will do that and will give us the operation of this center, which expand countrywide. And from there, Monjai will give you an update, quick update of the situation we are dealing with, and then we will entertain with few questions and then call it a day. Then Monday also we expect you here, and then we will give you another update. So this is how the proceedings will go, and I thank you very much for coming. Quickly now, I will give the mic to Sirim Modu to give us more details about the committee and the operations going on right now. Sirim Modu, you are most welcome.
Thank you very much, Buba. I would wish to add my voice to what you've just said formally. Welcome. Good. Thank you very much, Buba. I would want to add my voice to I'm sure they are already welcome within the EOC, but notwithstanding, on behalf of the coordination team, we wish to formally welcome you, the pressmen, who have left your valuable time to come and cover this particular event. Please be informed that, as stated by Buba, I will just be giving an outline or an overview, and the mouthpiece of the whole show would now be given the opportunity to give you the breakdown, that is the daily sit-rep. As stated by Buba, Since prior to the advent of this particular virus, let me formally inform you that the Ministry of Health and with partners have developed what is called the Public Health Emergency Preparedness and Response document. So when the issue of corona came into being, we looked at that particular document and tried to see what are some of the operational thematic areas that the document highlights. And from there, it clearly says that in such incident happen, one of the key things that we are expected to do is to put up a coordination team that would enforce those actions that are clearly stated in the document. And this is what necessitates this multi-sectoral committee. It's not a health committee or a national disaster management committee, but it's a committee comprising of experts from various domains. You see the security, you see NDMA, you see the Red Cross, you see GCAA, civil aviation, etc., etc. Now, when this happened at our first convergence, what we did was to develop an action plan. And action plans give us the sense of direction as to what are we to do, who is to do it, when is the person supposed to do it, and how is the person supposed to do it. Then that leads us to the formation of the subcommittees, where we have the surveillance, we have communication, with each of them having experts on those areas heading that particular thematic area. You have admin and finance, you have epidemiology, you have almost all the issues that are highlighted in the emergency response plan. We've set those committees. Then come the next phase, which is each committee has to report to this body on a daily basis. Because this is a pandemic that is so alarming that people need to be on top of issues on a daily basis. And this is why we are meeting every day to update the Gambian people, to update the Gambian authorities as to the state of the issues as far as response is concerned, but as well share with them some of our constraints, so that they would be able to enhance our operation. So this is actually what is being done from the onset, and I think the Gambian populace had been duly informed in the way that we are operating. And I think with this, I would want to appeal that let it be a continuous program. If it cannot be on a daily basis, but at least in every fortnight, we have such a forum where we will share with you what are the issues on the ground, how is it being managed, but what are the constraints and what are the recommendations that we have, so that nobody would say, I am not aware. However, I would also want to use this opportunity to say, by virtue of the existence of the social media, people are saying anything. And yesterday, I suppose you all saw a press release that was sent to say that Section 125 of the NDMA Act says, whoever is found to be giving a false alarm, false information leading to an alarm or panic, if caught, is liable to 500,000 payment or 5 years in jail or both. So, meaning, as much as we want to talk, let us ensure that we get to the right authorities, get the right information, so that it could be disseminated. We must not use this opportunity to bring about alarm in this country. We should try as much as possible to allay fears of the Gambian population. And this can be done if this cordial collaboration is between us, the coordination team, and you, the information disseminators. So we would want to nurture that particular relationship in between. Any information you need or any information you have before publish, ensure that you verify, authenticate before it is sent down to the masses. So having said that, for today's situation report, I would now allow Mr. Njai, who is our communication mouthpiece, to at least give you the most current update of the situation, and then we move on. I once again thank my colleagues in the whole coordination team. It had not been easy, but notwithstanding, we are all doing all efforts to ensure that what the Gambian populace need is being provided to them. We also want to appeal that every Gambian be cooperative. Cooperative in the sense that if you have anybody who comes from one of the hotspots areas, please don't hide them, bring them forward, because the risk is imminent. If they are kept in the houses, thinking that we're using that local methodology of Badiya, at the end of the day, it may cause a problem and which we may not be able to manage. We all love our people. We are one people, it's one Gambia, but the safety and security of the country cannot be compromised, cannot and will not be compromised. If I have a relative coming from places like Italy, France, UK, let me be bold enough and report to the authorities concerned. Already, the 1025 is operational 24 hours. It is there for you people. It is there for such to give the right information, give the right addresses, give the right telephone numbers. We have the personnel who are out there to undertake the tracing. They will go to you, talk to you humanly, try to see how best they could help you so that you could be at ease. So I thank you once again, and now allow Mr. Njai to proceed with the updates. Thank you once again.
Mr. Njai? Just check your mics. Yeah. Okay. Are we good to go? Okay. Are we okay? Ready to go? Yes. Oh, thank you very much, Chairman Serim Modou Diouf and your entire team. I want to say that we are happy at the ministry that the work we are doing, meeting here on a daily basis, trying to put information together, is a sign of commitment. Living our families, we are here from morning to evening. We want to thank you and your entire team for a job well done. And then the ministry is happy with this team, and we want to encourage you to continue the work we are doing. And also want to welcome my colleagues from the media houses, that we are happy to have you, and we're more than willing also to have you on a daily basis, from Monday to Saturday. Because we are very happy to work with you, because you have been supportive since the beginning. We've started a long way, and we are moving along, and we don't know where we're going to end, but we still want to be with you along the way. And I want to read the highlights first. On behalf of the Honorable Minister of Health, Honorable Hamid Lamin Samate, and the entire senior management of the ministry and the entire National Health Emergency Committee, on their behalf, I'm reading this statement. First, I will start with the highlights as to what is happening. The Gambia, if you can remember, recorded its first confirmed COVID-19 case on the 17th of March, 2020. The patient is in isolation and clinically stable under excellent care at the MRC clinic in Fajara. Currently, we have no new case, and as since the reported case, the index case was reported, we don't have any new case at the moment. We also have on the ground 20 surveillance officers who are trained, and they are currently helping us on the contact tracing, and as well as also they also been trained on standard operating procedures as part of their work in tracing the contacts. We also have over 30 staff of the Kanifing General Hospital who have been trained on infection control and prevention. And we also have pledges by some individuals who really want to support the response efforts. And also we are also having a systematic contact tracing also started. It began in earnest, and also contacts also have been line listed so far, and they've also been categorized. Travelers who also arrive from hotspot countries, which have also been highlighted before, are being quarantined for 14 days. This is mandatory, and there is no compromise with that. And in this quarantine, the government is providing accommodation free. The government is also providing food and water free, and also providing security, as well as also providing medical care, giving them medical personnel. So I think this is what the government is doing, and it's part of the quarantine, procedures, and we are also fulfilling, at the part of the government, we are also doing those ones. Going to the case history of the case we had, I want to give you just some little bit of information about that. The case of patient has been reported before. They say 21-year-old. It is not a 21-year-old lady. It is a 28-year-old female Gambian who is a resident of Western One Health Region. Kind of, as you know, we have 7 health regions, and this area where we are is the Western One Health Region, and also Western 2 is Brikama. You have Lower River Region, Central River Region, Upper River Region, North Bank East, and North Bank West. These are the health regions. It's a Gambian, and on the 9th of March, 2020, the case traveled to the UK on official duty. She returned to the Gambia on the 15th of March, 2020 via Royal Air Maroc, 8579 at about 1:49 a.m. Onset of symptoms began with fever, and that was on the 16th of March, and she also sought self-referral to MRC Gambia for testing on the same day. Sample was collected and tested at MRC Gambia laboratories. A positive test result was received at 6 p.m. On 17th of March 2020. This is the first confirmed case reported in the Gambia since the beginning of the pandemic in China in December 2019. Since self-reporting at MRC, the case had been isolated. Contacts were identified, listing and monitoring of comments also started, and also the National Public Health Emergency declared and WHO notified. When we had the case, we had to contact, we also have to do what we are supposed to do, monitor, and also a National Public Health Emergency declared to say the case is available, and also WHO had been notified, and that's the procedure, and that was also done. Going to the next level of the public health actions, in isolating the confirmed case, we also have various interventions that have been done. For example, at the level of coordination, we also had coordination meetings that were held. We also had an incident action plan modified to reflect the current the realities on the ground. And then IT department, we were also told to consider creating a virtual platform for coordinating meetings. Travel restrictions approved by the National Assembly for immediate implementation. Passengers from hotspot countries to be subjected to mandatory quarantine. Executive directives also given for the suspension of flights from not even 13 countries now, but about almost 43 countries that are also in hotspot countries, according to the new list that also came out. So going to the epidemiology, they are going to the epidemiology. I want to give you some little bit of. Okay. Is it this side? Yes. The epidemiology and surveillance. For quarantine, we had 28 in number, and cumulative, we have 34. Self-isolation, we have 5, cumulative 45. Suspected cases, 0, cumulative 0. Contacts traced, 36, cumulative 41. Confirmed cases for number 0 and cumulative 1. So we have overall, we have 1, and as of yesterday and today, the number of confirmed cases 0. So the cumulative for meaning we have only 1 case. That is the cumulative, that is 1. Deaths 0 for number, and then also cumulative 0. So meaning we have no deaths. You will hear a lot of rumors going on, but rely on this information we are giving you. We will share this material with you, but just to give you the summaries. Going to laboratory. Samples collected, 4 were collected, cumulative 13. Sample tested 3, cumulative 12. Test results available 4, cumulative 10. Test results pending 1, cumulative 1. Test results negative 3, and also cumulative 9. So meaning we have total number of 9 negative cases. Test results positive 0 for number, 0, and then also for cumulative we still have 1. Test results inconclusive 0, and also cumulative, we also have 0 for that one. Going to the constraints, we have delays in release of funds to train rapid response teams, clinicians and other support staff, and also that one also has been sorted out. Actions have been taken, and then today all those procedures will be sorted out. Funds yet to be committed to a Public Health Emergency Operation Center to adequately reposition to the situation as it unfolds. Standard operating procedures for case management and screening at airport not available as of now, and a lack of real-time data for effective response. That is data gaps in terms of number and type of measures being taken. That is number of people screened at both ground, air, and seaports, number quarantine, and number on self-isolation, etc. The next steps. We are also continuing our contact tracing, monitoring and active case finding, exploring possibility of additional sample kits, PPEs, other operational logistics. Expansion of laboratory testing on National Public Health Laboratory, standard joint operations, strengthen Joint Operations Center, JOC, sea surveillance activity at landing sites, strengthen community awareness activities on COVID-19, and finalization of the Public Health Emergency Operation legislation. These are the steps we want to take, and I'm sure by the time we meet again, we'll give an update. And with regards to funds delays release, and those ones been sorted out, ministers have given a directive, and then discussions have been done with Minister of Finance, and then now all those procedures have been sorted out. And I'm sure by Monday, most of the departments will get their funds. And today, for communication, we are also trying to finalize our posters and everything, and then we are going to bind to make sure all those billboards that were supposed to be requested have been procured on time. So we don't have any barriers in that area now. All those discussions have been done yesterday and day before yesterday between Minister of Health and Minister of Finance, and then it has been sorted out. Because if you know government funds, before it is released, it has to go to certain procedures, and those procedures must be followed. And you cannot bend the rules. You can also take a shortcut. So we have to follow the procurement procedures. We also have to follow the financial procedures. So all those things must be followed and observed. And that is why perhaps when the money was announced, and then after the time that the money was released, there is a little bit of gap. But like remember, this was I think was Monday. That it was Tuesday it was announced, and then Wednesday, Thursday the procedures have to be followed, and then the PS and other team have to make sure that all those procurement issues have been sorted out. We had the approval from DPPA, and all those things must be sorted out. And then, alhamdulillah, those ones have been done for the procurement and also release of funds for capacity strengthening. Those ones have been sorted out as of now. Thank you.
Thank you very much. That was a very quick update, and almost we have come to the end of the press briefing. Just to highlight some of the points that Director just made. He was giving you some figures as of yesterday. So this data is as of yesterday. We didn't have the data for today yet. So the team here, from here, they're going to meet and gather, as the chairman said. Each and every section is coming to give us an update as far as their operation is concerned. For instance, we have people in the field who are doing the contact tracing, meaning they are following up cases, and then whenever they come across those cases or those people who have contacts with the index case, then they are going to see how best the person got tested, and then the results would also be given to this committee to put it into what we call daily situational report. And this is the daily situational report we are sharing with you, and we hope that we will continue with this. So he made mention of certain figures which are yesterday, and the cumulative is what has come from day one up to yesterday. So when he said cumulatively 3 tested, as of yesterday, 3 tested negative, and the cumulative number of tests is 9. So this means, as of now, we have 9 that are being tested negative. So we have only 1 pending result, and hopefully by today we will get that one. And if it turns out to be negative, we will also add it to the cumulative number. So this is how things are going, and we have our officers in the field. They are monitoring all the contacts, the flights, those who join the flight, and then they are in touch with them, meaning that they want to see everybody in that flight got tested. So we will give you an update as when it is available. On that note, we will entertain questions, and before we close, and quickly, we have the staffs here to respond. If you have any question, you can let us know. Then we will be more than willing to answer. So the floor is open for Q&A. Thank you. Yeah, I have the first hand here first. Yeah. That's iAfrica.
Yeah, I'm Lamin Kante from iAfrica TV. Yesterday in the evening, a Turkish airline landed in the country, and we made to understand that few passengers were being screened at the airport and then later being given the chance to go home. We want to know what mechanisms did you people put in place, or what type of screening did you do in order to qualify that those people are free from the said virus, in as much as we also got information that in the same flight there are other passengers who are from the hotspots, but selecting few to go, leaving them to go home, whilst the rest being taken to wherever. So we really want to know what procedure have you guys taken in inside. And the other one is.
Yeah, go ahead. I'm taking note.
The other one is in relation to the 500,000 fine that the disaster man have said. We at media, or we the journalists, continue to face challenges in terms of getting information. If we don't have information, we look for other sources. Because either you know it or not, the way you people have been called to ask questions, we had of social information. It's the same way that the media also get those concerns from their respective followers. So in which we owe them an obligation, that is to respond to whatever concern they have. But media have, not only this issue of corona thing, have continued to face challenges in getting access to information. One may be a full institution, only one individual will be responsible to give information. If the individual is busy the whole day, meaning the information that will be circulating on social media or on WhatsApp groups will continue to flow, because media, we deserve, okay, we would like to protect our credibility. So we will not want to publish anything, but we continue to face that challenge. What mechanisms are you people really putting in place to talk to the media
thank you.
Whenever the need arises, and especially this set press conference to be on a daily basis?
Yeah, so Sana would answer your first question relating to...
I just want to respond to the second and then move on for Sana to come. That is in relation to section 125 of the act that I've talked about. At the tail end of my opening remarks, I said this particular forum is one to create that mechanism with you, whereby whatever information you need, you would get access to it. This is why you are being welcomed here on a daily basis, to get real-time data on what is happening on the ground. Okay, but as much as that is concerned, as much as we also want to report, we have to ensure that what we give to the people does not lead to another crisis. We are already in a crisis. We don't want to create another crisis. And this is where the law is there. So this is just a reminder to show anybody who is using the social media that you don't say anything that you want to say. Here we have created this platform to give you all the necessary information that is of value to the people. So feel free at any time, get to Modnjai, get to me, get to Sana Sambo, or any member of the team. Because what we are doing is not an open secret. We sit here every day, we scrutinize every information. You don't even come and give a report and we say, take note. No. Every information put on the table has to be verified, has to be vetted, has to be agreed upon before it is circulated, which I suppose is the most credible information you can ever have. So let's keep the momentum. Let's keep that social interaction between us As long as that is concerned, be rest assured, we'll allay that fear of yours. So I now allow Sana on the issue of how the issue of the airport is being handled to also give response to that. Thank you. No, I'm moving for him to have access. No.
I thank everybody for taking your time to come here and join us to share information. It is we really welcome this, and I only hope we'll have enough time to be doing this frequently. I think that will help us to let the people have the information that they need to know. This issue of screening at the airport, people have to understand there are procedures for everything. We know that the number of people coming into this country from outside is too much. And there is no single capacity in the country that can handle all of them. If we want to quarantine everybody, I don't think we have space for that. Flights are coming every day, meaning the quarantine number is increasing every day. And every individual quarantine is going to stay in that facility for 14 days. So it's not a one-off thing. Those who come today, go out tomorrow, another one's come. It's not like that. You have to keep each of them for 14 days. And this number keeps on increasing by day. Imagine how many flights are coming, how many people are in that flight. This is a huge number. And we need to take care of their welfare. We need to make sure they are comfortable and things like that. This is a huge challenge for the ministry that they cannot handle alone. This is why we have our partners around us for each to play their role and make sure this is possible. At the airport, what normally happens is there is a case definition that we follow. And also there is a definition for contacts. People thought everybody from a hotspot is affected. It's not like that. Otherwise, they would all have been in quarantine in their own countries. Okay? It's not like that. What we do is we have a triage system at the airport, depending on your exposure. So we have high-risk groups and low-risk groups. What we mean by high-risk groups, that's a definition for it, meaning those people have been exposed, either during transit or during travel, or from the countries where they themselves come from. They've been exposed to the virus. Even whereas they have anybody coming, even if you are affected, that 14 days incubation period, you have to go through that to be able to show signs and symptoms of the disease. You cannot be infected today, tomorrow you start showing signs of symptoms. It's not like that. This is why we have that 14 days period. So everybody is going to be checked for that 14 days period, whether you're going to develop signs and symptoms or not. So when we screen them at the airport, we put them into two categories. Those that are of high risk, we make sure we quarantine them, where we can actually monitor what is the developments up to the 14 days. If they show signs and symptoms, we start taking samples. If the sample tested positive, we're going to move you from that quarantine and move you to a treatment center. Okay? If you don't show any sign of the disease until the end of the 14 days period, you will be released to go home. Under strict conditions, under strict supervision, we give a lot of information. Not that your 14 days is over, so you may not be a case again. You still have to continue monitoring yourself. If you see anything abnormal, then you have to call back to us, and we visit you and see what we can do. Those who are left to go home, these are the low-risk group, based on WHO definitions of who is a case and who is not a case, or who is a suspect and who is not a suspect, and who is a contact or who is not a contact. Okay? So we allow them to go under you are from unaffected. We are not saying you are affected because we haven't seen anything. So we have no legal mandate to put you under custody or quarantine you. People have their rights as well. Everybody has to understand. It doesn't mean all the flights coming are going to be quarantined. I think every sensible man should know that is just really impossible, because we have to house them very well, like how they live in their houses, provide all the social amenities and things like that, including food. This is a very expensive endeavor, and it takes a lot of time. So when we screen you, normally the camera at the airport looks at a fever. Every disease starts with fever. We look at your fever, because if you are going to develop a disease, fever is what will come first. So the thermographic cameras and the other thermometers we are using, that's what we are looking for. A fever more than 37 degrees centigrade. That's the normal temperature everybody should have. It can be elevated based on so many factors. Psychological, whether you have other sicknesses that may cause that. Okay, clinicians are hearing me, of course. So, but then we make sure if you are restless, we can check you even 2 or 3 times to make sure our readings are correct. And the people have to understand we are human beings. The resources we are using are made by human beings. Errors can happen. So anybody who is not manifesting fever, we cannot keep you there. We know you are from an affected country. We look at our criteria. Based on that, we say you are at high risk or you are at low risk. And we see where you have to go. If you are going into the community, back to your people, we advise you strictly. If you love your family, I don't think you should keep quiet about that. You go and stay with your family like that. We cannot monitor, sit down there and monitor everybody in their homes. Everybody should take instruction from us if you love your people. Otherwise, if you keep away information, you're killing your own people. Our biggest problem is people who we are not seeing and they are in the community. And they are not telling us that they are in the community. Okay? That's a very dangerous one. The ones we see in airport and taking care of them, we don't have any problem with that. But the ones we are not seeing and they are in the community, if they happen to start developing a case, that's what we call local transmission. Imagine if I should come from Europe, I'm at home, how many people are coming to greet me? How many people am I going to socialize with? And all those people are also going to have their own contacts as well. So disease spread very fast. That's one of the reasons why this disease spreads very, very fast. And so many people can be involved. If we cannot respond to all, people start dying. So it's everybody's responsibility to look for cases. It's not only the health sector. Everybody, all of us here, including the community. That's what we want from the community. Please tell us if you have visitors, or if you know your visitors are coming, so that we work together and avoid them coming to infect you at your homes. Hiding people who have traveled and they are here without telling us is suicidal. Because whenever they grow as a case, develop case signs and symptoms, they're going to infect so many people. And we know that there are people also who don't show any sign at all. These are what we call asymptomatic people. They have the virus in their system. They are not showing any signs and symptoms. How can we see these people? It is only through travel history, a lot of information that we need to be able to detect those people. Otherwise, they are not sick, they're everywhere, and we have a right to pin them down. So let's understand this system of triage system at the airport. This is why we are putting some people away in their homes and follow them through telephone calls, because we cannot see everybody. We don't have the resources.
Thank you very much.
Okay.
I think that's we might have 1 or 2 more. I have my brother there from GTV.
My name is Mamukase. I just have 2 questions. This is something we just said. But before that, you understand 14 people escaped quarantine from the hotel that you kept them. And the authorities, when I spoke to them 2 days ago, said they are hunting them. How far did that hunting exercise?
Thank you.
My second question is about the people kept at the quarantine center. I managed to speak to some of them.
Okay.
And the revelations they tell me were so disturbing.
Okay.
That the hotel in the first place is an abandoned place. Some of the facilities have been dilapidated.
Yeah.
And going to the extent of even accusing the authorities responsible that out of the many that we have put there, some are already given the green light to go. And the first thing they told them when they put them on the quarantine was they would have kept there for 14 days to see the signs and symptoms. But as we speak, there are less than 6 people currently at the hotel after speaking to them from last night, out of 15. Okay. So I want the authorities to say that. Okay,
so I will give Sana just 2 minutes to answer to these 2 questions at a time. And then we have 1 more, because as I said, we have a lot of work that we're supposed to do right now, and we're supposed to give you more updates. So our field workers are coming with information that we need to package for you people and for Gambians as well. So please, we don't have much time, and you can be patient with us. We will answer this one, and then we will take 1 more. Then we will call it a day. So quickly.
Yes, thank you very much, gentlemen. That's a question that needs to be asked, because, as I said, people have to understand quarantine issues. If only, as I said, you love your country, you should not jump quarantine. Even if you are going to sit and complain, it's better than running away, which I think everybody should go against. And the reason why that happened is actually the first day, when we were very much in stress. Remember, this is a new outbreak. The country is trying to prepare. We are not telling anybody that we are ready. Preparedness is a continuous process. I don't know whether you know or not, even during outbreaks, the first few cases normally die because before you adopt, it becomes a problem. So that's some of the arrangement problems that we have, which we accepted very well, and we apologize to everybody for those lapses. But since that happened, it never happened again. If you should know how many people are under quarantine now, it's just far, far more than the number we're talking about. And they're in almost 3 or 4 locations. I don't know where have you been. That might be only a single location, but we have others as well in other different locations. So if complaint is coming from one location out of 3, 1 out of 3 or 1 out of 4, I think that's kind of normal. We are not saying we are perfect. I've said it here. This is a very difficult thing to do. People have to get patient with us. It's just 14 days. And then this problem will be over.
But are you also concerned about the location that you put them in? Like
that's what I'm saying. Yeah, that's what I'm saying. You want us to put them in hotels where people are? We cannot put them there. You don't put these people in the community. So we have to work with people around to help us. We don't have those locations. There is no quarantine center in this country. All the quarantines we have are temporal ones. Nobody ever thought we're going to have a caliber of an outbreak like this. Otherwise, we would have prepared for it. You can see the little place we prepared now is becoming, we need almost 3 or 4 times more than that. If flights don't stop as of now, you're going to see more problems because we cannot cope anymore, which you have to understand very well. As I said, quarantine is not a simple thing. Remember keeping more than 100 or 300 people for 14 days each, and you have to provide all their welfare. This is not only health responsibility. I think it should be a collective.
Last question. Let me, I'm coming.
Yeah,
I'm coming.
Okay, yeah, so
that's why.
Okay,
thank you.
very quickly, one
I just want to say that the 14 people, what they have done, they are against the Public Health Act, and when they are caught, we are finding them and we'll give you. Buba is telling you that we are going to compile data, and that data, if you want to know where they are, just come here on Monday. You will know what has happened. We're going to give you that information, and they're going to face the full force of the law. Because why? Because we are not supposed to jump. It's just like somebody taken to prison and the person jumped and went away and the person is caught. You know what happened? So it's the same as because now what is happening? The risk is high because they're already with us. We don't know whether they have the disease or not, or we don't know if they're infected from somewhere else or not. We don't know. But perhaps if they have it, then the people they have contacted with now, meaning they've just come to pass the disease to other people who are not even, these are innocent people. And that's what they have done. So we are going to, we will not tell you but the procedures, what we are supposed to do as public health practitioners is already highlighted in documents. And we're going to go by that. So we'll give an update on that. With regards to also the condition of the hotel, let me tell you, if you take me to a place and I don't want to stay there, I can tell you all sort of information so that I can be taken away from that place. And that is what is currently happening now. They are just giving us all sort alleging us, giving us all sort of information that we have not done A, B, and C. And they even commented, and some of you have carried that story, that there was no health worker that was at the airport and also at the quarantine center. If you have a director of health service, regional director, for example, you also have the director of public health service, you have the permanent secretary. What do you need also at that place now? These are the core people you need. They were, director of public health service was at the airport. The permanent secretary was, the director of health service was there. You come to the quarantine center, they are always frequent there. All our staff were there, the doctors were there. I think we have done what we can do. As Sana said, our system, perhaps people may underrate what we are doing as a Minister of Health, but our system is far better than many systems in other parts of the African country. I think people have to acknowledge what we are doing as a sector and work with us to strengthen what we are doing. That's what we're now asking people to do. But the stories they are giving you, we are not saying it is true or it is false. But the condition they want to put themselves in, that's so that people can sympathize with them. People can say, oh, they cannot be here. They have to move away from that. These are some of the students. But the government is doing a lot. Giving you accommodation, giving you feeding, and giving you medical care, giving you security, and giving you water at all times. I think what we are doing, it is not expected, and we are doing what we are supposed to do. So let them bear with us for a while. It's not easy to keep someone for 2 weeks. It was not expected. They were also doing that, but we just have to go. But it's a procedure. Remember during the bubonic plague, 100 years ago, what happened? People have been locked up in places. People have been quarantined in prisons. We have heard about it. If you read public health, it will tell you. People have been taken to prisons and then, kept there for the number of days they wanted them to be there. Just at least some of them were more than 21 days. So just because of the condition at that time. So if you have a condition like this, now you have you have air conditioning in the room, you have all facilities, water, food, you have security, you have medical officer. I think they just have to bear with us. What is worse is these people come now, we help them now to escape, and we allow them to go to the communities. That's the worst case scenario. What will happen if people want that also in the Gambia? We can think about that. We can debate it. If they want, we can release all of them. They go to the communities, and they start infecting all our people. Who will like that? No one will like that. So what they want to be released to go home, and then they have to bear with us. These are public health procedures. We have to go. We'll pass this stage. These are 2 weeks, and then they are done, and they're getting all the care we can. Let them just help us now to tell us how best we can improve. Sure. That will help us a lot. But if you are there to criticize all the time, just tell us, I did A, B, and C. We'll think about it, and we'll see whether it's feasible, and we'll work on that. Thank you. That's what we are doing. Thank you.
Maybe quickly, just to add that yes, we've had this story, but also we have a unit called the tracing unit, who are also trying to trace each and every one of them. Okay, so that they are gone. No, we have created a special unit that is tracing wherever they are. And once they are caught, the rules would apply, as Modjai said. Thank you. So we just, not that we had it, we are now folding our hands, but we are working, and some of them are already within our custody for your information. Yeah. We already got a lot of them, in fact. In fact, I'm sure I expect in today's report, because the team is going to tell us, as at today's, how many. That's why I don't want to go into figures. Okay? Immediately after this press conference, I'm meeting again with the team so that each subcommittee gives me a detail of what is happening on your end. So by tomorrow, we can give you how many of them are within our possession.
Thank you very much. I think those are very clear. I am running out of time.
One thing I have to say is we have increased our number of case investigators, contact tracers. A team, public health officers. The schools are closed now, the universities are closed. So we have brought a lot of them here, train them as to how contact tracing is done, equip them, give them the facilities to do that. So those have come yesterday. They have been trained. Yesterday they started their job. So we expect them to report to us so that we know precisely what are the figures for yesterday. So and also some of them are even, because I think they are scared now, they are calling to the 1025 for us to trace them.
So I just want to thank you very much, because I don't have much time. I will give my yes. Quickly, please. Just one.
The first one is with regards to the flights that are coming in.
Yes.
And some who said that when they come, they assess those who are high risk and low risk. But given that this virus can be contacted even in the plane as you're walking out, because someone can just have the virus and then as you're walking out, maybe have it.
Yeah.
And you can also detect it maybe based on the symptoms for 14 days. And do you think probably it would be ideal to keep everybody, quarantine everybody? And if you do not have the capacity to do that, wouldn't you think it would be better advice would be to stop flights from coming in? That's the first question.
Even not flights alone.
I think one could be enough.
No, because I need to ask.
I don't know.
Yeah, I agree. Sorry. Let me just make my point clear. Your point, I will give you more time. Yeah. So I agree. I will give you some time. We all agree we are dealing with a crisis and people need information. And we are ready to have one-on-one interview with any media house, please. Let's make it short, because we need to produce a situational report, which you guys will need tomorrow. Absolutely. And if you don't have that, at hand, probably it will. So, but you can come up with your question, second one quickly, and then he will do it once. Yeah.
Then the second one is, I understand in some other countries, and I think even Senegal, when they discovered a case, they did a risk assessment of how much potential people could be infected and prepare according to that. In the Gambian situation, how much do we think how much are we prepared to take in terms of numbers? And probably a short one to that. They said that people with diabetes, lungs-related diseases, cancer are at high risk level, and if they are infected, they are likely to need a ventilator, like something that would help them to breathe. How many ventilators do we have here in this country?
All right. So I will give Sana to, and maybe for the issue of ventilator, Ali Sankara would if you have any idea or so. But first question, which is in relation to the airport.
Yeah.
So Sana, you can.
I think the young man has to understand. Let's know that our country is not a developed country. We are a developing country, and we lack a lot of resources to be able to compare us with other countries. If you compare 1 and 2, you should be very careful, looking at our competencies, our capacities, our number, and things like that. Gambia, we don't have that. Okay. Imagine if you want to quarantine everybody. That's our best aim. If we can have everybody under one umbrella, where they can easily be monitored, where they can easily be managed. We don't like it this way. But as I said, it is not easy to quarantine everybody. Where is the facility? Where are we going to get that facility from? Where we can keep thousands of people? Do we have the human resource capacity to be checking all these people every day? And things like that. So these are some of the challenges we are also facing as a government, as a system. It's good you ask this, that people know that we are kind of overstretched with the little resources we have as a developing country. You cannot compare us with developed countries. So we are doing the little we have based on the little capacity that we have. Okay? Because if we will stay here, is this an emergency operation center where we monitor things very, very, very carefully. Okay? So we're doing our best, and we want people to come to our aid and see how best they can provide additional support, especially the international partners around, local partners. All of you, if you think you can support, that's what we want, to quarantine everybody under one suitable complex, isolated from people, and maybe in the long run, because these are learning situations. We've learned a lot from Ebola. There was nothing like an emergency center here when Ebola came. Emergency operation centers in all the countries in Africa, most of them came as a result of the Ebola. Otherwise, we cannot coordinate emergencies very effectively. So this is why you have a command center where all the partners come. You can see it's from the military air job, representing the security, NDMA, from the regions, Red Cross, and so on and so forth. We all converge in one room, even the airport authorities. They are here with us. So this is where all emergencies are coordinated from, so that we speak the same language, so that information sharing becomes easy and things like that. And these situation reports all come from that. And the reason why we are producing all this is for people to know and see where we have challenges and deficiencies and see how best we can help. That's what we want, but we don't have the capacity really to house everybody.
Yes, but as much as just to add on, as much as our operations are concerned, one thing that we are very much concerned with, we're looking at the 3 tiers. That is the best case scenario, the likely case scenario, and the worst case scenario. Because in management, these are the 3 tiers. And we are very considerate as far as our planning sector is concerned, looking at the best case scenario, the likely case scenario, and the worst case scenario. It is on the worst case scenario that he spoke on, that the capacity is not there. But for the best case scenario, we are managing it. The likely case scenario, we expect perhaps a case more to come. We don't pray for it. Those are issues we can contain. But if it moves to the 3rd tier, which is the worst case scenario, Gambia don't have that capacity to be realistic enough. But all that we are operating on and all the means we are applying are all within international standards. Okay? And as it is being shared with you, other countries sharing their situation report. We are equally, Gambia, sharing the same with other countries, and people have been appreciating it. So now it's an issue of applying principle 1. What is principle 1? Be it a victim or a non-victim, the number 1 person to protect you is yourself. The first priority is yourself. Take care of yourself, know where to go, how to behave, how to interact, and so on, and make sure the precautionary measures that are being displayed is adhered to the latter.
Thank you.
This is the bottom line. Once people go by that, Gambia will be safe.
Let me just respond to your concern. If you don't mind. I just got one, as Sana rightly mentioned. People we are monitoring them, and now people are coming out. They themselves are now coming out because they know they'll be caught. I got one message here that one of those people who left the hotel just called me, and it's a non-Gambian. I don't want to disclose, and the telephone number is already here. And now the lady is now scared, and that we are looking for. Now we can call. She gave her number that we can call her so that we'll take her to the next where she's supposed to be. Just now. Now they know we are looking after them. They are now coming out now. That's enough. No, somebody was asking about how do we trace them. No, QCell, not you.
To stop an incoming flight. If you know your capacity is overstretched.
I think that very quickly. That's has to come from somewhere. But we have recommended.
Just wait till tomorrow.
The advice could be made.
Yes, I know. But what we want to say is that if you do very well,
yeah, you see, that's why flights have been moved now.
I think if you do well, you will not fall into category 3. I think that's what is more important. And even I remember, even in Uganda currently, they are holding their suspects or in a hotel, and at their own cost, because they are paying $100 per day, and they are complaining. We are not asking those in Karachi to pay a bootload. I think we are doing very well. Other countries are charging the very people they are holding. So I think people should cooperate. Like what director is saying, I think it's important for people to cooperate and understand.
Thank you. So I'm really sorry. I think QTV, you made mention.
We will give an
update tomorrow. Please, we will give you an update on that, and then please bear with us. You said you need.
No, we don't want to give you wrong information.
I can give you one more question. I can give you one more question. As far as you said you want bonus, this is because.
No, I was referring to.
Okay, then that's fine. The last question comes from Mr. Cameraman there. I don't know his name, but he said it was English. Okay, but then it's okay now.
No, you can just say it.
So he was saying, why can't government of the Gambia declared a state of emergency for a very short period? Hence, our capacity is running out. And I think we need to clarify it. What we mean that our capacity is running out. It's not a matter of our capacity running out. I don't think so. But maybe, Mr. Chair, you can quickly talk.
Thank you. It's a brilliant suggestion. One of the reasons why we put up this platform is to advise government on a daily basis. Perhaps after this press conference, once the records we are receiving today is alarming, then we would advise government. Because the situation has to determine your next step. It cannot just come out of the blues. Okay? As the situation is now, we are coping with it fine. We are just being told that even those that had jumped the fence have started calling that we go for them. So that means we are moving on the right direction. However, the revelations received on a daily basis determines what sort of advice we give to government. If our today's meeting showed that the way in things are going is quite alarming, then we would advise the Honorable Minister to advise the executive to take this step for the betterment of all. But it does not just come out of the blue. It has to be factual. The figures and the realities have to be made available before we advise. Thank you. Evidently.
Because you will recall, even WHO, at the first 2 months, they didn't declare it as a pandemic because it depends on the situation.
Yeah.
It has to get to that level before a decision can be made on a particular measure. So I think it's the same procedure or it's the same principle. Yeah. We are not at that level yet, but once we are there, we will advise the decision makers to do those kind of measures. So I think we are following the same procedure.
Thank you.
Thank you very much. I think. Okay. So I have one more. Wow.
I just want to ask about your own officials, your health officials who are in the field. What health control mechanism, prevention mechanisms are you providing for them? Also, are you creating any risk allowance for them?
So I will give that to Alaji Sankare. He has something to say, and then he will
talk about that.
Yeah. So Alaji.
No, I just finally want to appeal to those who are on board the Royal Rock that came with the case, and their family members, to those we are unable to reach, by telephone, because we not get the telephone contact of so many of them. If they can call 1025 and then give us their details so that we can follow them up. Quite naturally, we don't want to go to that extreme level where we have to use the law to calm them down. So let them just call 1025 and then give us their details, and the tracing team will then follow them up and then discuss with them and then follow them on a daily basis. Yeah. And actually, we have also provided PPEs in all the POAs. That's the personal protection, GS. Yeah, for those equipment for our staff working at those levels.
In relation to the last question,
I can respond to that. I was just with the minister yesterday evening up to around 8 p.m. And then it has been finalized. Now we just waiting for the list of people who are who are doing the work. And in fact, I even was able to categorize to him those who have been working from January, from February to March. We just need to look at it. So all those things have to be identified. So today I need to go with that list, because we are currently going to work on the procurement and the accountant, the PS, they are all in Banjul. So we're going to work on that so that at least we have allowances for those people who are at the points of entry. In fact, Minister even said anybody who is involved into this, and everybody should definitely be able to have the allowance. So that is already been sorted out. We've already planned, but because the funds were not released at that time, so that now that at least instructions have been given for the funds to be released, so we are moving on with that.
Thank you very much. So I think I will bring this to an end with just a short announcement that these sort of updates will be coming more frequently, and except Sunday. So that's why I said the next one more frequently. So please bear with us. We want to devise a way how best we can improve on the information sharing. Yeah, and we will not all converge at this call.
nag dama kontaan bu baax sax si ñëw bi nga ñëw seet si suma tabax gi kontaan naa ci trop.
maa gën a kontaan bi ma ñëwee fekk sa tabax bi toll fii waaye nag man kontaanuma ci sama kër gi man.
lu xew
ndax umpale wu loon ñoo bokkoon nekk Europe.
dëgg la
jamono yu ñu nekkee foofu yëpp man ak yow maa ngi am benn waay maa ngi ko yónnee xaalis bu bari pour mu sampal ma suma kër. te ba léegi tabax bi àggul fenn. te yow nga waxoon ma ne ma bi nga starté samp yàggul léegi nga toll fii.
li waral loolu nag mooy dama ànd ak waa Baluwo.
kon su ma la déggee Baluwo dañuy yëngu ci samp kër tamit.
ni ngay def nag yomb na da ngay log on to www.baluwo.com mun ngaa jënd ci ñoom ciment suuf banta weñ ba ci daaj yi nga xam ne di nga ko soxla lépp lu jëm ci wàllu samp rek mun nga koo am ci lu yomb ak Baluwo daal yaay dugal sa xaalis fi nga ko.